Live. So welcome to this afternoon's discussion on Carrie. I assume we're going with the original. Where would the group like to start?
Mrs. White.
Okay. What's your observation?
At the end of the movie, she talked about her husband
Hmm?
and what he may have caused on her. Not sure why she is the way she is, but she's projecting all of her, whatever she went through onto her daughter, and it's very, very extreme. Even to the fact where she thought that her menstrual cycle starting was her causing a sin, which is crazy. I'm sure she knows biology because she's probably gotten her menstrual cycle too. And she also didn't tell her daughter about it at all. And her thinking so many things is a sin, and just, I think she's a very extreme person, religiously maybe, but that definitely was caused because of her ex-husband, where she was also in denial that he left her for another woman. So she was in denial too.
Mm-hmm. Do we know that she was married, or is it just Carrie's father? She is married, right?
I think in the movie, Carrie says that the dad left. So
With another woman.
Mm-hmm.
Yeah.
Yeah. Any more to this?
She's not getting any help, clearly.
Zero. Mm-hmm. And that's both for, whether it's friend support, I don't know if any other family, and she's certainly not getting any psychiatric support, right? Mental health services.
Even though everyone's very aware of it, like the principal, I'm assuming, mentioned that, oh, it's just her mom, how her mom is.
Mm-hmm. Anything more either you would, well, let me start asking it in the form of a question. Anything more you'd want to know about her?
I have a feeling it was like sexual abuse a little bit, because she did say she enjoyed it, but that doesn't mean that she didn't go through it. It just seems like her response is very extreme, intense about it. So that's where my mind would go to.
That's a fair question. That's a question we would certainly consider asking in a psychiatric evaluation. Anything else? How about the timing of events? Anything of interest there?
When she hit her cycle.
Well, we may inquire. What else? I mean, you kind of alluded to this in talking about her relationship with her husband, or her ex-husband, but we're kind of circling a little bit. I think there's something much, much more important to tease out here. All right, let me switch gears then. You're the writer-director, and you are going to create a prequel to this. In terms of writing a script, what are some things that now you have to consider or should consider?
Her childhood.
More specifically, what about her childhood? How would you write up her childhood? So I want two people to answer. So not at the same time, of course, but my question for the second person will have everything to do with what the initial response is. Who wants to offer it?
well, she was raised in like an extremely religious environment where she was kind of like shamed, and like anything kind of sexual, like premarital, anything like that was considered taboo and shameful. So she's kind of projecting that onto Carrie.
Okay. So, again, for those of you who may not have heard, your biosketch, your wiki would be for this a young Mrs. White to be brought up in a family that is austere, very, very, very restricting, very super ego driven, very structured, very rigid. And in that way, we can then look at the adult version and say that this seems to have been a continuation from those early relationships established in childhood. Words in your mouth, but that's what I'm hearing. Okay? What if I gave you another scenario? So I'm actually going to answer the second question. in which we see a complete opposite Mrs. White when she's young. She's fun, she's outgoing. She makes tons of friends, very popular at school, both with her same sex as well as the opposite sex. She dates. And that all changes when she gets married. Does your psychiatric assessment of this character now change?
Yes.
Completely, right? And I think, this character is very polarizing. And I think the one thing we have to keep in mind, not just as an audience member, but as future psychiatrists, psychologists, and other healthcare providers, is that we are just seeing her in a slice of time during which she is a single parent caring for a very, very troubled teen. And that how our initial impression of her, which I think is a very common impression, I see Wiki where she's one of the most hated Stephen King characters created. And I think that's by the intent of the author. But that how we can that perspective can be completely different and completely changed if only a past developmental history that would be completely opposite of what we would expect. Right? I think that's the main teaching point here. Any other observations for Mrs. White?
I think the fact that you asked that question makes me feel like maybe that she was outgoing, and after she got married, maybe the husband would have not abused but something, and it changed her entire mindset on that, and she just wanted to protect her daughter.
Mm-hmm.
I feel like because we didn't have a backstory on her, we immediately hate her, but we would sympathize with her if we knew why she is the way she is.
Yeah, and I think the paradox here, and not that I want to make sure I state this correctly, but she gets a lot of hate from the public, where I think that disgust really should be directed towards her husband, especially in light of maybe a history that is completely devoid of any behaviors that we see here. And I don't know if that exists. If someone wants to get on the wiki and find out if she actually has a bio, it would be very interesting to see. My gut says is that I don't think Stephen King has the energy or the desire to paint this character in a positive light and provide her early childhood experiences that would be normative. But boy, if he did, what a much more complex character she becomes. And all of these ideas that we have that are right now directed towards her really are misdirected, and therefore otherwise should be directed towards her husband, right? That person who really gets no conversation whatsoever. He's barely scripted, but boy, I think he would embody everything that I think call it prejudice directed towards Mrs. White.
Because she wouldn't want her daughter to go through what she did with the husband.
Mm-hmm. Let's switch gears and talk about her daughter. What did you say?
That insecure and fragile person.
Mm-hmm.
Bullied a lot.
Mm-hmm.
Very low self-esteem.
I don't think she had anyone to go to as well, except the teacher maybe.
Yeah.
The gym teacher.
Mm-hmm.
So lonely.
Speaking of which, I think somebody should actually look at this character and compare them to Donnie Darko. The interactions with the gym teacher are interesting in both these films. So I think two very diverse films. And the interesting thing in compare and contrast, I don't want to give anything away, but I think once we land on a particular diagnosis for Carrie, I do think there's something in terms of comparing and contrasting with the character Donnie Darko. So these two films might actually have more in common than we might actually think at first glance. But to be determined. We have to first figure out what's going on with Carrie.
I think her response in the showers was a little... She did think she was dying, but it was a little... I don't know. I just felt bad for her.
Hmm?
She seems to be not only physically underdeveloped but emotionally underdeveloped, just kind of popcorning off of that. like the way that she dealt with that situation was very, like there wasn't much like verbal recognition of what was going on. There was a lot of screaming and panic without any way to communicate that in a way that a grown adult would understand entirely.
I think she's 16. Any medical diagnosis here for her? Somebody has her first menses at 16?
Sorry, I think she might be 18 because it was her senior prom. Or 17, 18. Because they went to their senior prom.
Yeah,
right?
17 to 18 time frame.
And there is some discrepancy between the book and the film too.
Oh.
So there's like a year. So 17/16, probably fair.
You can have a delayed like menstrual cycle if you have like anorexia or eating disorder.
And how does that appear on exams in terms of the actual medical condition? What is it called?
Is it? Oh, sorry.
No.
Like anorexia nervosa. Or,
Are you talking about amenorrhea?
oh.
Yeah. I know you guys didn't expect to say that word during your 4-week psych rotation, but primary or secondary? Yeah, right. Primary amenorrhea. Right. So I think that should become the focus of clinical attention here. I mean, to say that opening scene is pivotal is an understatement. I think, but I think when we look at it, we see the bullying, we see the emotional distress. We lose the fact that there is a physiologic component to this that prompts all of the above, and that's primary amenorrhea in our patient, right? And again, for those of you who are not in medical school, primary amenorrhea is just the observation. It's the actual description of someone who has a late first menses, delayed first menses. And we can get into the differential diagnosis for that in a little bit. Right? But before that, what else did you say?
I noticed something that when she was locked into that room and she was supposed to pray, when she comes, she was like yelling at her mom and blaming her and saying a lot of honest things. But once she comes out, she thanks her mom, which I don't really understand why she would just come out and be like, thank you, Mom, for making me do that, like a punishment.
It's called ambivalence. All right, it's called ambivalence. And that's normative. Again, that's normal. In this case, adolescent behavior, where you can actually have dual feelings towards a single person. What is the opposite of ambivalence? What is it when an individual is unable to tolerate that and only can see the world through black or white?
Splitting?
Yeah. Yeah. Other observations? How else would you describe Carrie, the character?
You just feel bad for her.
No, describe her.
I feel like she has such a need and a want and desire to be normal and to be happy and live a good life and not be under such a high control from her mom. It feels like she can't escape that, and it's causing her to be very timid.
I agree. Describe her.
I think her telekinesis, is that what that was called, like was like a metaphor for her like standing up for herself finally, because she's like allowed everyone to like hurt her so much, even her mom. Like I think that was the breakthrough moment for her, which was like, no, I'm gonna like stand for myself.
I don't disagree. And I think there is strong symbolism of both telekinesis and pyrokinesis. Describe her. I still have not gotten a mental image. I've never seen this movie, and I still can't picture what she looks like.
She's like a skinny little girl, and she's scared, and I think she's really anxious all the time because she's getting constantly bullied, and she has nobody, so she's very lonely. She's trying very hard to not be who she is, but I think she gives in a couple of times, and then the rest of the time she's really trying to fight. But everyone's just constantly bringing her down, like 24/7. I don't think she has a safe space.
Yeah. They
So-
call her creepy Carrie. She's
Creepy.
like the long hair, the bulging blue eyes.
So long hair, bulging eyes, skinny, guarded / anxious. I heard anxious. Okay.
I think she feels very lonely. For sure.
What is she wearing?
A dress,
What does her makeup look like?
No makeup.
pale.
Pale?
Maybe pale, like ghost-like complexion.
Ghost-like. Would you get a CBC on her? What might you expect to see?
Anemia?
Right. Okay. The anemia might be consistent with her also being skinny. A common cause.
She is always in a dress, actually.
Tight fitting?
No, very
No,
loose.
like very
like a
loose.
sundress, almost.
I should say more curtain, like
Yeah,
when, like,
just,
they-
like a straight.
That's very loose.
yeah, like
very, like,
like
Victorian vibe.
very yeah. It's almost like someone took like the curtain drapes and just kind of just took it off
so
with
that
a
she
rod
can
and just,
show her body shape, maybe.
Yeah.
No, nothing revealing.
Gotcha. That also might contribute to what I heard the observation was in her shower, too,
Yeah.
where she didn't have loose-fitting clothes to cover anything up. How about her hair? Look healthy?
No, stringy.
Very.
All right, so if we will begin to formulate what might be going on in our main character, choice A being a mood anxiety cluster versus choice B, psychotic dissociative cluster, we're pulling 99 undergraduates. Report back to me the results. What do you think the majority of those 99 undergraduates would say? A, is Carrie struggling with the mood anxiety cluster, or are there elements to this movie that better support B, psychotic dissociative? What are some of the things Carrie would tell us she's experiencing if we were to provide a diagnostic interview right now? I heard anxious. What else?
Just for the movie's sake, I would say not hallucinations, but she thinks she can telekinesis.
So I could move things, and I could set things on fire.
Yeah.
99 undergraduates, what are they going to tell us, A or B?
Can you repeat A and B again?
A is anxiety / depressive. B, psychotic / dissociative. B?
Yeah,
B?
B.
Okay, consensus B. Now, the good news here is that, again, this is the only way to kind of process our thoughts, i.e. formulate, so there's no wrong answer. It's a question of which path you choose to go down. Consensus says B, psychotic dissociative. If psychotic dissociative, we will always choose schizophrenia as a starting point.
Mm-hmm.
Right? So demonstrate your knowledge of DSM, demonstrate your knowledge base for the shelf exam. Give me the 4 inclusion criteria for schizophrenia. Anybody?
Greater than 6 months.
So we're looking at 5 symptoms.
Delusions or hallucinations.
It's not constant, I believe, right? It's a, oh wait, no, that's something else, sorry.
Does the negative symptoms count?
Disorganized or catatonic behavior.
That's a 4. I'll give you 4. Sorry.
Oh.
I'm hiding.
Positive symptoms? Is it like the persistent?
Disorganized speech or thought process, right? So we have 4 positive symptoms: disorganized speech or thought process, disorganized or grossly catatonic behavior, delusions, hallucinations. They're all positive symptoms, right? They're all the pathological presence of something that at baseline should not be there. And then you have negative symptoms, any negative symptoms. So that's 5 total. Does Carrie rule in at this point? Does she have at least 2 of those? The answer is yes, right? So she has schizophrenia, right? Well, before we say yes, we have to acknowledge and appreciate that this condition is a diagnosis of exclusion. So now you're going to give me the 5 different illnesses that we have to investigate and rule out in order to continue to rule in schizophrenia as a provisional. Schizoaffective disorder, good.
BPD.
Bipolar disorder or a primary mood illness, yeah, that's 2.
Substance use.
A substance-induced psychotic disorder, 3.
Medically.
That due to a medical condition, 4, and autism spectrum makes it 5. All right, well, first, is there a mood component to what we see in Carrie? If the answer is no, we rule against schizoaffective and primary mood disorder. If we say yes, we're going to have to keep those in our differential.
Does that mean like mood?
Yeah. Do we think there's an aspect of depression or mania in her clinical picture? I got a no here.
Yes.
I got a yes here. Well, who's going to split the tie? Yeah, another yes.
100%.
If we're on a borderline, we're going to say yes, just to play it safe. I'd rather say yes, keep it in, and be wrong, than rule it out, start her on the wrong medication, and enact a misguided treatment plan to make things worse. So if we're split, we're going to say yes, and we're going to keep both schizoaffective and a primary mood disorder in their differential diagnosis. All right? In Carrie, there is evidence of an autism spectrum disorder. A, yes. B, no. C, it doesn't matter.
What would the criteria be for the autism?
You have to ask a child psychiatrist. We have to actually get somebody to consult.
I don't think she does.
That's all I got B, no. Any A? Yes. There is
I think,
evidence.
I think yes.
I got one yes, one no. Anyone go for C? Doesn't matter. I got one C. And the reason why it doesn't matter is just recalling why the American Psychiatric Association requires investigators to consider, and that is there's overlap. Right? Individuals with autism spectrum will have grossly disorganized behavior and even speech thought process. And if that's the case, if we knew in the prequel there was a pre-existing condition of autism spectrum, we have to strongly consider that continues to manifest in this film. However, even with that pre-existing condition, we would not expect our autism patient to have hallucinations or delusions. There's no overlap there. And because you nodded both yes to those positive symptoms, it doesn't matter if the prequel establishes ASD as a pre-existing condition. So the correct answer is C. It doesn't even matter. All right. Is there evidence of drug use in this movie? Could this, that is Carrie, be a fictional case of a substance-induced psychotic disorder?
No.
Or no? Okay. Second question. With no discrete evidence, should we be reassured that therefore Carrie isn't about an SI psychotic disorder? No, because we have to continue to have a high clinical index of suspicion. We'll leave it in a differential. It's a little lower than it otherwise would be, but we're going to leave it in anyway because at first glance, we should never as clinicians be reassured that substances are not playing a prominent role, right? All right, and then finally, same question now pertaining to an underlying medical condition. Is there discrete evidence in the script that Carrie has a medical condition that would explain what we're seeing?
No evidence, but you don't know the history of the parents.
Right, so there's no evidence. If we got the script up and we searched different key words, nothing's going to come up. Same follow-up question, on a test especially. So we'll frame this for the shelf exam. Despite or given the lack of evidence, would the test taker be reassured that that is Carrie, the film, is not a fictional depiction of a psychotic process due to another medical condition? And the answer here is yes. Why?
There's nothing that points to like a medical illness that needs to be treated.
Right? And I think here we need two specifics. That you're going to have to tell me the two protective factors against having an underlying medical condition.
Her age.
And?
Gender.
And her gender, or sex. right? If this were a 60-year-old male, you're going to say no. I mean, and that's the same exact way you'll approach us on a shelf exam. 60-year-old men do not get off the hook when it comes to not providing lab results consistent with an underlying medical condition because of their age as well as their sex. Those are two risk factors. On the other hand, the opposite is true for females who are young, right? And Carrie is a young female, so I'm not so sure this is about. We could actually cross that off our list. All right. The final step in formulating what ails Carrie White is looking at all of the above. And if we had taken notes during this movie, is there anything else staring at you on your notes page that have not yet been explained by any of the conditions we've just discussed? Because if there's some more stuff there, we have to explain it. We have to actually extend our differential. So we're thinking Carrie may have schizophrenia, cannot definitively rule out schizoaffective disorder versus a primary mood disorder, given the fact that we feel that there are depressive symptoms. And although current evidence does not support, we cannot definitively rule against a substance-induced psychotic disorder at this time. That's where we would leave it, unless we have information that has not yet been explained by any of those four conditions. So here is an underweight, pale, young female who is wearing baggy clothes, who has primary amenorrhea, sitting at her office, and we're about to label her schizophrenic.
You have to think about anorexia.
Yeah. Right? That'd be a concern here. Right? So I do think we have to consider that. And given the fact that anorexia nervosa is thought to be a continuum illness with dissociative disorders, a lot of dissociative disorders can explain the symptoms of schizophrenia that we just described to. So that's something I think we'd have to consider here. Right. Other thoughts? Carrie? So what is anorexia?
Eating disorder.
Eating disorder, yeah. Feeding and eating disorder, characterized by?
Significantly low weight, a fear of gaining weight, and behaviors to maintain that.
Right.
BMI less than 20.
17.5. Close enough. And that defines the underweight. And that is critical to understand, right? That is, there is a fear of gaining weight despite being underweight, right? And underweight here is 17.5 as a body mass index. Bulimia, ARFID, binge eating disorder, none of them include that fear of gaining weight despite being underweight. That single criterion compound sentence differentiates anorexia from all of the above, right? If I search the script, I don't see any fear in gaining weight. She might be underweight, right? And this parallels clinical practice where if you ask 100 times, you might get an answer 99 out of the 100. I have no fear of gaining weight. What's your position at this point?
I think there's a lot more going on than thinking about that, I feel.
Now, but the question was, when a patient tells you that they have no fear in gaining weight, what's your next step?
I might ask them, like, how would you feel if you stepped on the scale and gained 5 pounds, or are you doing anything to prevent yourself from gaining weight?
Yeah, I mean, be very careful during, whether it's the first time you watch a movie, whether it's the first time you interview a patient, to allow the information you gather to establish a diagnosis, especially when you're looking at pertinent negatives, all right? People who have anorexia often incorporate denial as a very strong and very rigid defense mechanism. You can't take that feedback verbatim, right? So, and this parallels the script where if you actually brought the script up, use the search term fear, it may not come up that she has a fear of gaining weight. Doesn't matter. Anorexia will be a differential diagnosis nonetheless of what ails Carrie White, right? Treatment. What do you want to do here? How are you going to help Carrie to ensure that the natural progression of this condition, or plural conditions, is aborted and therefore does not cause her clinically significant distress or impairment in functioning. In their sequel, she's back to her old 6-year-old smiling self.
Well, definitely inpatient management. If we're considering like schizophrenia or any of the like with the delusions, then like antipsychotics.
Yeah. We in discussing treatment plans, we often forget to establish the level of care the treatment plan should be implemented. So I like the fact that you started your idea off with that. And of course, we've seen the ending. So she's in imminent danger to herself and especially others. So no matter what the plan entails, it's going to be implemented at a level that is no less restrictive than an inpatient psychiatric unit. I think that's very fair, and that's the correct way to proceed. All right. And then I think inpatient focuses on the urgent situation, making sure your patient's safe. And once they're safe, you have a handoff, whether it's an eating disorder unit or an intensive outpatient plan, addressing her apparent psychotic symptoms as well as maybe her aberrant eating behaviors. Further questions or final questions? Carrie. Do we see Carrie binge or purge at all in this movie?
Isn't it
Right. What's the other subtype? It looks like ARFID though.
Restricted.
Yeah, restrictive, right? And that was my next question. So please restate what you just said. Your observation? No, before that. That she didn't even need it at all.
Oh, so you need it all.
Yeah. Again, I don't think that the script was written with that intent, but it's very coincidental that she doesn't put a single morsel of food in her mouth through the entire movie, and we could definitely interpret this as potentially being restrictive subtype, right? Restrictive subtype usually has other characteristics that are reliably associated. So in binge eating and purging subtype, you think of more impulsivity, you think of overlap with some cluster B traits, if not cluster B. Personality disorders that can be premorbid, substance use disorders, all part of the binge eating and purging subtype picture. What about the restricting subtype, which Carrie may have? What are some characteristics that we might consider here?
More perfectionist, like OCPD type traits.
Right. Anxious traits, cluster C traits, OCPD traits. Did our writer-director get this right? Did De Palma nail this? It might actually tap into your prior observation about how she thanked her mother. There might be some commonalities here between the two. Mom is very obsessive, intrusive thoughts. So there might be some. I heard Carrie herself described as anxious before. They get this right. I mean, what we see in terms of the character and how we would describe this character is consistent with the literature in terms of those types of traits we would expect to see being comorbid with the restricting subtype. So it's a consideration. Final thoughts? We're good? All right, we'll leave it here.